Canada and the ADAO Organizing Committee for asking me to speak today. It's a true honor for me to be here and share a little bit about my story and the Canadian Mesothelioma Foundation and what we're all about. So, what is the Canadian Mesothelioma Foundation and why did I start it? As I mentioned last night, my husband and love of my life was diagnosed with mesothelioma in 2003 and unfortunately died 2 years later in 2005. Initially, I was sort of overcome with grief and anger, and in fact, those feelings were almost crippling, in that I had difficulty even getting to work on a daily basis and dealing with patients and my patients' problems, and taking care of my kids. But over time, I felt that I needed to do something, that as a physician, that I had maybe some medical knowledge that could be helpful to helping others in Canada who had been diagnosed with mesothelioma. Now, granted, my expertise in medicine had nothing to do with mesothelioma until my husband was diagnosed with the disease. In fact, I hadn't even thought about it up until that point, since I was in medical school, and I remembered having one patient as a clinical clerk who had been diagnosed with mesothelioma. But it was a far cry from my dealing with pediatric patients and more specifically adolescent medicine. I was much more involved in sex, drugs, and rock and roll than thinking about mesothelioma. But I felt in any event that my expertise as a physician and my background and knowledge of the language could be of some help. But it was actually one of my sons who came up with the idea of forming the foundation. He came home one day and said, "Mom, we really, really need to do something. We have to help others in Canada who are going through what we went through. Our journey was very difficult. We felt very isolated. If you remember back in 2003, 2004, there wasn't that much information available like there is today. Now we have so much on the internet. We can find out all kinds of information, but it isn't that long ago, but there really wasn't very much at that time. So between my feelings as a physician and partner of someone who had mesothelioma and my son's suggestion, we decided to form the CMF, and we made a vow that we were going to help others, support them as best we could in their fight with mesothelioma. So we started thinking about this, but as you all, well, maybe not all of you know, but it takes a while to actually form a charitable foundation. There's a lot of legal things that you have to deal with and come up with a board and come up with all kinds of things. And so it took us till 2008 until the foundation was actually formed. And we decided at that time that our main mission would be to raise awareness and understanding of mesothelioma in Canada, and also to make very well known the link between asbestos exposure and the development of mesothelioma or other asbestos-related diseases. And our mandate that we set out at the time was to provide education and support. And this education and support would be geared towards the general public, and more specifically as well to patients, families, caregivers, and healthcare professionals. So what we decided to do in terms of healthcare providers is we're actually in the midst of developing this. It isn't in place just yet, but we've just finished completing a grant proposal to form a healthcare network to bring experts in mesothelioma from across the country together to form sort of a collaborative effort to facilitate exchange of information and use as a way also to educate frontline healthcare workers about mesothelioma, the latest in terms of diagnosis, treatment, and be able to post clinical trials and match resources with where mesothelioma exists in our country. One of my colleagues, Dr. Paul Demers, who's a leading epidemiologist who directs the Center for Occupational Cancer of Ontario. I forget the exact name, but he's in charge of that organization, and they've done a mapping exercise where they've identified pockets of mesothelioma in high density areas like in Sarnia and other places in Canada where there are particularly high incidence of mesothelioma. And what we are planning to do is see how we can best match that up with resources. The other thing that we've done is we've been supporting the organization of conferences and symposia for healthcare workers to learn more about advances in the treatment of mesothelioma. We have information on our website that's geared for patients, families, caregivers. We we're trying to help them identify what resources are available. We get a lot of emails, phone calls, and respond to them immediately with inquiries about treatment and all kinds of questions that people who have been diagnosed with mesothelioma might have. We have a Facebook page, and we also provide through Facebook support groups. These are private and are by invitation only, so that people feel comfortable sharing information with others who are going through similar circumstances as they are. So we have one for patients, we have one for caregivers, and one for people who are bereaved, who've lost somebody to mesothelioma. We also use other forms of social media to provide information. And we do public speaking as well. So the information that we post is, just to provide basic information, clinical information about mesothelioma, and to provide a realistic roadmap of options for patients and their families. Another area that we felt we should include on our website is the whole area of compensation. I had been misinformed when my husband passed away that I wouldn't be eligible for any trust funds because that's only in the United States. But in fact, I found out much later on that those trust funds are also available for Canadians. It's all North Americans. But for me, that was too late. So I wanted to make sure that other Canadians knew that either through workmen's compensation or through trust funds that they might be eligible for compensation. But like the ADAO, we don't make direct referrals to any law firms and aren't associated with any particular law firms. We are an independent charitable foundation. And the other very important thing that we do on our website and our Facebook page is to really call for advocacy in the area of asbestos and asbestos awareness and the linkage between asbestos and diseases like mesothelioma. So we do a lot of fundraising and to support our endeavors. We're all volunteers, we're not paid, but we do want to be able to provide support. So through our fundraising efforts, we've been able to give grants on an annual basis to the Mesothelioma Research Program at the University Health Network in Toronto, where they're doing some groundbreaking work in this area. We also have given financial support to organizers of other symposia and want to be able to support educational programs across the country. So one of the ways we have been able to collaborate in the past with the ADAO is we had Linda Reinstein as one of our keynote speakers at a conference that we held, I think it was 2 years ago, where we brought together patients, families, workers, employers, healthcare providers, and other stakeholders to share information, to talk about advocacy issues. And Linda did a fantastic job talking about the wonderful work that the ADAO is doing, and it was also a forum for us to talk about what kind of advocacy work is necessary in Canada, as well as providing treatment updates during that conference. So one of the lessons that I've learned during this time is that we're all much more effective when we work together. That when we operate in our individual silos, that our voice isn't the same as when we come together. So even being able to do things like this, having Linda participate with us. I work with other groups in Canada to try to be more effective in what we're trying to achieve. Also we're trying to partner and ally ourselves with other groups and organizations. So what are our goals for the future? We want to really develop this healthcare network that I talked about a little bit earlier. I see that as a very, very important thing for us to be able to achieve. There's so much work that needs to be done to provide the education that's necessary and which will ultimately, hopefully, help patients and their families in terms of being able to access the best treatment available. So that we're continuing to do that work. We want to continue to provide grants to programs that are involved in work in mesothelioma. And one of the most important things is continuing to provide support and education to patients and families. It's a very scary diagnosis, and I know what I felt like, so I'm just trying to help in any way that, well, not just me, our foundation is trying to help in any way we possibly can to make this journey a little bit less difficult and people to feel not quite as isolated as we felt when we went through this. And finally, but very importantly, we want to continue to support work to raise awareness about the link between asbestos exposure and mesothelioma. So I know that Carmen Tiano talked a little bit about some of the legislation in various parts of Canada as it relates to asbestos, and talked about how hopeful we are now with our new government that there will be a total ban on asbestos in Canada. So this actually started way before our new government started, and I guess that the previous Conservative government saw the writing on the wall when there were changes made to Health Canada's policies and positions on asbestos. Previously, they had said that chrysotile asbestos isn't harmful, and they changed that position. They also added to their position that there is no safe threshold to exposure to asbestos. So they had really sort of been difficult to change over many years, but I guess they finally, this was just before the election that this happened, and I don't know whether it had anything to do with that, but it was nice to see that that was happening even without the change of government. There's been a lot of media exposure recently in Canada about the link between mesothelioma and asbestos exposure. There's this really fantastic journalist who works for the Globe and Mail called Tavia Grant, and she's written a series of articles over the last few years. Some of them have been really very moving, where she's interviewed patients who have spoken very eloquently about what their journey has been like. And in her last article that just appeared a few weeks ago, she quoted actually Paul Demers and his work, and the fact that they have noted that the single largest cause of workplace death in Canada is related to asbestos exposure, which is like quite dramatic. In addition to Tavia Grant's article, and I don't think it was coincidental, there were editorials in not only the Globe and Mail and the Toronto Star, which are probably our two leading newspapers, but other national newspapers and a lot of local newspapers all calling for a ban on asbestos. So that's like a major accomplishment that within like a space of about 2 weeks, these editorials appeared. And it was just a few weeks ago that this happened. And I think Linda was on a phone call also just a few weeks ago where a group of people involved as a coalition were finalizing plans to write a letter to our Prime Minister, which was sent. And it's a very, very powerful letter, also calling for a total ban of asbestos and lots of detail. It's really a very, very good letter. So hopefully that will also have impact. And I, like Carmen Tiano, feel very, very optimistic that there will be a ban on asbestos in the very near future in Canada. One of the other areas that he touched on was demanding a registry for public buildings that are filled with asbestos. And to date, the only province that has done that is Saskatchewan, but we're hopeful that that will change as well. So what's next? There's obviously a lot of work still ahead of us, both in terms of helping with improving diagnosis and treatment of mesothelioma, and also in the area of raising awareness. Even though these editorials have appeared, there's still a lot of, I'm sort of surprised, because even though we don't have advertising about mesothelioma by law firms, it's not allowed in Canada. We all get American TV, so we all hear about mesothelioma, but I'm always amazed at how many people don't really know much about it, how many people don't really know that asbestos is still being imported in Canada. Finally, a few years ago, we stopped exporting it, but we're still importing it in brake pads and cement pipes, It's still being used, and it still is all over the place in houses, as many people have already discussed yesterday. So we still need to continue to raise awareness about this. And as I said earlier as well, the way to achieve that is for us to work together. And even if we are able to achieve a total ban on asbestos in Canada, our work isn't over until we, as the world community, are able to achieve our goals. So anyway, thank you very much for listening to me. Thank you.